Welcome to Break the Needle. I'm your host, Adam Zivo, and I'm here to tackle Canada's problems with drugs, addiction, and crime. Today, we'll be chatting with Elenore Sturko, an independent member of British Columbia's Legislative Assembly. Elenore has been a leading critic of the province's radical harm reduction policies, most notably so called safer supply and drug decriminalization. Her political advocacy called attention to how these policies eroded public safety and harmed drug users themselves, and she contributed greatly to the provincial government's decision to bring decriminalization to a definitive end this year. She's going to walk us through how British Columbia implemented decriminalization, what went wrong, and what might happen now that the experiment is dead. Thanks for joining us, Eleanor.
Thanks for having me on, Adam.
Now, Eleanor, can you give us a rundown of what drug decriminalization looked like in British Columbia? What were the details of this policy? What was allowed and what was forbidden?
Yeah, so this was an agreement really that came between our province and the federal government through Health Canada, asking for an exemption through the Controlled Drugs and Substances Act to stop charging people for possession of drugs of 2.5 grams or less for their personal use. So drug trafficking still was illegal, allegedly. And there were certain places where drugs were also supposedly forbidden from use, places like schoolyards, airports, other places like that. But it was really quickly that we actually continued to see. And one of the biggest problems is that drug use actually happened almost everywhere after decriminalization. I think that the intent, behind trying to remove stigma from people who are seeking help for an addiction or to stop using drugs. I think that is, a righteous reason to want to make some changes. But unfortunately, just simply ignoring laws and failing to have any form of accountability or guidelines in terms of helping people to deal with problem behaviors, that was problematic. And so this really was a policy of simply ignoring certain parts of the law and not anything like what you might have, for example, in Portugal, which is that instead of criminal law, you have an administrative process, administrative penalties that brings you before the Dissuasion Commission and actually holds people still accountable for behaviors that are actually harmful for the rest of the community.
So, you mentioned that one of the reasons why the provincial government decided to implement decriminalization was to reduce stigma, ostensibly so people could seek treatment. But why did they choose to implement this policy at this point in time? Why the early 2020s? What were some of the conversations that were happening in the lead up to this change?
Well, so I was elected in 2022 in a by-election, and I became the critic for mental health and addiction in December of 2022. Prior to that, we were in the midst of what was declared in 2016 to be a public health emergency for overdoses. At that time, we were getting some months well below 100 people dying of overdoses, which is a lot. But then by the time we had reached the mid 2020s, we were seeing sometimes hundreds of people dying a month. At the worst year of overdose deaths in our history, we had well over 2,600 drug overdose deaths in British Columbia. And so we're talking about a really severe problem, which is seen in many, cities across North America. But British Columbia, in particular, was one of the epicenters where we were seeing on average 5 to 6 people dying a day. So, in that context, they set up, a health committee where it was bipartisan. They had people from community groups, a lot of activists coming in to talk about what they saw as solutions to the overdose crisis. A lot of activism, I would say, also within the federal public service, within influential positions, with research bodies, including the BC Center for Substance Use, and really a push, I believe, towards drug legalization, which had begun a lot earlier than that. But it's my opinion that we had some people in some pretty influential positions who thought that they had a solution, some of whom stood to potentially profit from pushing certain drug-based solutions, and it influenced policy. So,
Eleanor, I'm going to have to interrupt you. We're going to go to commercial break, but once we get back, we're going to talk about what the immediate impacts of decriminalization were and how they differed from all the theoretical assumptions made by these policy makers and these researchers?